Hello, I'm Dr. Wickham Simonds. I'm a obesity medicine specialist in the Triangle region of North Carolina, and this is Obesity Medicine Perspective. So for those of you who've been watching these short educational videos, I've talked before about the idea that obesity is a disease. And as we start the new year of 2016, I want to continue to highlight that and make both patients and other healthcare providers aware of that. So I was reading last week in an article in the Los Angeles Times a report about this subject that a reporter wrote. And the reporter interviewed some of my colleagues who are influential in this field of obesity. And these individuals had written a commentary. There were four of them, and they that are big names in the field of obesity, and that are from universities like University of Colorado and Northwestern University and Cornell University, so recognizable schools. And they wrote a commentary to the British medical journal, The Lancet. So we know the New England Journal of Medicine as being kind of a real famous medical journal, and it is the second most famous in the world, but the first most famous is the British medical journal, The Lancet. So this is a big deal when a commentary appears in a medical journal like that, because it's going to be seen around the world by a lot of people. So the commentary was about do not tell patients that diet and exercise is enough to treat obesity. And it's not. Their point is that this is a disease that's much more complex than that, and you're oversimplifying things when you tell people this. So I just want to read a couple quotes from the commentary that appear in this article from the Los Angeles Times. Once obesity is established, however, body weight seems to become biologically stamped in and defended, wrote Mount Sinai weight management expert Christopher Ochsner and colleagues from the medical faculties of the University of Colorado, Northwestern University, and the University of Pennsylvania. Few individuals ever truly recover from obesity, the authors wrote. Those that do, they add, still have obesity in remission and are biologically very different from individuals of the same sex, age, and body weight who never had obesity. They are constantly at war with their body's efforts to return them to their highest sustained weight. The depressing fact, said Ochsner in an interview, is that the average adult with sustained obesity has less than a 1% chance of reattaining and maintaining a healthy body weight without surgery. Okay, so that highlights, there's a whole bunch of reasons why all this is, but the bottom line is, once you become obese, there is a biological change that takes place. It is stamped in, it is permanent, and it is very hard to return to your normal weight. And if you do, it's very hard to sustain it. And to tell someone just to diet and exercise is an inadequate response to this. It's ridiculous. It's stupid. It doesn't make a bit of sense. This is a complex medical problem. It takes a more aggressive approach than that. And we need to use a lot more tools than that. And this is one of the reasons I am in the business that I'm in. This is obesity medicine. We talk very specifically about what type of diets work and what sorts of lifestyle activities make a difference. And then we pair that with treatment. Prescription medication, and maybe several prescription medications are required. And not just for the short term. If you want to lose this weight and then keep it off, you have to work at it, and then look, you have to sustain it. And it may be a lifelong treatment plan that you really need. And you need to wrap your mind around this, that this is not going to be, I'm going to lose 30 pounds for the wedding and it's never going to come back on. That's not what we're dealing with here. This is a much more serious condition. I want you this year and going forward from there to be absolutely serious about treating this medical condition. I want you to think about it differently. So until we talk the next time, I'll give you the tools and information. You give me the effort, and together we'll overcome obesity.